My name is Senu Apewokin. I'm an associate professor of medicine at UC, and I'm an infectious disease doctor. And so my role is to take care of patients who have infectious diseases, including those who have COVID. My focus mostly is on people with immunocompromised conditions, so people who have heart transplants, kidney transplants, and liver transplants, including stem cell transplants. So those people are placed on drugs that suppress the immune system. And so my role is to try and help prevent infections or treat infections in these people. So COVID, when people get exposed to the SARS-CoV-2, which is the virus that causes COVID-19, it may take a few days for them to develop symptoms. So we call that the presymptomatic phase. And that could vary. That could be sometimes between 3 to 5 days before they actually start developing symptoms. So if one is exposed and necessarily doesn't have a cough, it doesn't necessarily mean that that person is not going to develop symptoms a few days later. And so that's why they need to get tested. And even when people get exposed to SARS-CoV-2, some people may not develop any major symptoms at all. So there are some asymptomatic people who actually get SARS-CoV-2 and don't develop any symptoms throughout their whole exposure or illness. But those people are necessary to identify because they can spread the virus to another person. They can spread the virus to someone who's elderly, who would be really or probably really sick if they're exposed to SARS-CoV-2. So it's important to isolate or to identify those individuals and isolate them such that they don't cause harm to the community or other people that could be more predisposed to more serious problems when they're exposed to the virus. So there are a few things. The first is, I think the scientific community is learning more and more that COVID-19, unlike or more so than seasonal influenza, may be transmitted through airborne, through aerosols, or there may be a component of airborne transmission that is more common in COVID-19 than it is with seasonal influenza. And what that means is that it's probably more common to transmit the virus. So that's one, it's more likely to transmit COVID-19 than it is to transmit in seasonal influenza. So that's the first. The second also is that, seasonal influenza has been with us for a long time. So we have established protocols on how to manage, how to treat, and there are guidelines that are written. In fact, our work has been cited in those guidelines that are written on how to treat, manage outbreaks of seasonal influenza. With COVID, that's not the case. In fact, with COVID, we're flying the plane whilst we build it. It's so to speak, using that adage. So we're learning a lot as we go with COVID-19 whilst they establish guidelines and guidance for seasonal influenza. The other thing about seasonal influenza is that there are very effective antivirals, several effective antivirals for seasonal influenza. And that we can't say the same for COVID. There's only one drug that is currently approved, antiviral that is approved, and we're using that, but that's just what we have. We don't have that many at this point. And the final thing is that if you take the number of cases of deaths due to seasonal influenza, the CDC counted or tallied the number of deaths from October last year to April. They're around about 60,000+. And that's over 6 months for seasonal influenza. If you look at the same number, the number of deaths so far we've seen out from COVID in the US, between February and now, they're over 130,000. So you looking at those numbers, you can see that COVID seems much more deadlier than seasonal influenza. Unfortunately, it's not going to be very easy to tell the difference all the time between a common cold and COVID. There is some overlap. There are, some of the symptoms would overlap, like, runny nose, maybe muscle aches, some will overlap. There are some symptoms also that we see more commonly with COVID-19 than we see with influenza, like loss of taste and loss of smell. However, the problem is that because there's considerable overlap between the symptoms of these two illnesses, one cannot rely on symptoms alone to say, I either have COVID-19 or I either have seasonal influenza. Of course, if one has more the loss of taste and loss of smell, the likelihood is more likely that this is probably COVID than it is seasonal influenza. But we may not be able to rely on symptoms alone as the distinguisher between these two illnesses, and that's why we need to get tested in order to make that difference clear. That is a question we're trying to answer. We don't know yet, and a lot of work is going on at this point in time to try and figure out whether that a prior exposure or prior infection, whether it confers immunity against subsequent infections. Even if it does, how long that immunity or that protection is going to last is not clear as well, and we need to answer that as well. So, I think those are very important questions that everybody wants answers to. I say if anybody's exposed, has a potential exposure to SARS-CoV-2, that person should get tested. So we have learned over these few months that yes, children may not get as sick as often as elderly adults or even adults, but that doesn't necessarily mean they don't get sick at all. And there are a lot of reports of children actually dying of SARS-CoV-2. So I think it's important, one, to get tested. The second reason to get tested also is that even though kids or teenagers may not be sick, they may be sources of transmission to an elderly, to a grandparent or to a parent. And that secondary transmission could be fatal for that individual. So that's one reason from a public health perspective also to get tested, so one can appropriately identify these individuals and prevent transmission into the broader community.